161. A 9-month-old should be able to wave bye-bye. True or false? Answer: true. Rationale: by 9 months, infants typically develop social gestures like waving bye-bye, reflecting fine motor and social development per infant developmental milestones. 162. Fruit juice should be limited to 8 ounces daily for preschoolers. True or false? Answer: true. Rationale: the American Academy of Pediatrics recommends limiting fruit juice to 4 to 6 ounces daily for preschoolers to prevent obesity and dental issues. 163. The HPV vaccine is administered to prevent hepatitis B infections. True or false? Answer: false. Rationale: the HPV vaccine prevents human papillomavirus infections, not hepatitis B, which has a separate vaccine per CDC immunization schedules. 164. A heart rate of 100 beats per minute is normal for a 3-year-old at rest. True or false? Answer: true. Rationale: a 3-year-old's normal heart rate is 80 to 130 beats per minute at rest, with 100 being within the typical range, per pediatric vital sign norms. 165. Family-centered care includes providing resources for parental education. True or false? Answer: true. Rationale: providing educational resources empowers parents to participate in their child's care, a key aspect of family-centered care per pediatric nursing principles. 166. Pool fences are unnecessary for homes with school-age children. True or false? Answer: false. Rationale: pool fences prevent drowning in school-age children who may access pools unsupervised per pediatric safety guidelines. 167. The sucking reflex in neonates disappears by 12 months. True or false? Answer: true. Rationale: the sucking reflex, essential for feeding, typically fades by 12 months as voluntary feeding develops, per neonatal developmental milestones. 168. Adolescents require the same caloric intake as adults. True or false? Answer: false. Rationale: adolescents have higher caloric needs than adults due to growth spurts, varying by activity level and gender, per pediatric nutrition guidelines. 169. Sucrose solution is an effective pain relief method for neonates during procedures. True or false? Answer: true. Rationale: sucrose solution reduces pain perception in neonates during procedures like heel sticks, per pediatric pain management guidelines. 170. Nurses can share a child's vaccination status with schools without consent. True or false? Answer: false. Rationale: sharing vaccination status requires parental consent under HIPAA, except in specific public health mandates, per legal standards. 171. A 5-year-old should be able to dress themselves independently. True or false? Answer: true. Rationale: by age 5, children typically can dress themselves, reflecting fine motor and self-care development, per school-age developmental milestones. 172. Whole milk is recommended for children over 5 years. True or false? Answer: false. Rationale: children over 2 can transition to low-fat or skim milk to reduce saturated fat intake, per pediatric nutrition guidelines. 173. The varicella vaccine requires only 1 dose for full protection. True or false? Answer: false. Rationale: the varicella vaccine requires 2 doses at 12 to 15 months and 4 to 6 years for full protection against chickenpox, per CDC immunization schedules. 174. A temperature of 39 degrees Celsius is considered normal for a 6-year-old. True or false? Answer: false. Rationale: a 6-year-old's normal temperature is 36.6 to 38 degrees Celsius. 39 degrees Celsius indicates fever, requiring assessment, per pediatric vital sign norms. 175. Play is an effective way to assess a toddler's developmental status. True or false? Answer: true. Rationale: observing play helps assess a toddler's motor, social, and cognitive development, per pediatric assessment principles. 176. Smoke detectors are optional in homes with adolescents. True or false? Answer: false. Rationale: Smoke detectors are essential in all homes, including those with adolescents, to prevent fire-related injuries per pediatric safety guidelines. 177. The Babinski reflex is normal in a 2-year-old. True or false? Answer: false. Rationale: the Babinski reflex typically disappears by 12 to 24 months. Its presence in a 2-year-old may indicate neurological issues, per developmental milestones. 178. Adolescents should receive the same medication doses as younger children. True or false? Answer: false. Rationale: adolescent medication doses are often weight-based or closer to adult doses due to mature metabolism, per pediatric pharmacology principles. 179. Distraction techniques are effective for pain management in adolescents. True or false? Answer: true. Rationale: distraction, such as music or games, reduces pain perception in adolescents by engaging their attention, per pediatric pain management guidelines. 180. Nurses can administer vaccinations without documenting the lot number. True or false? Answer: false. Rationale: documenting the vaccine lot number ensures traceability and safety, a requirement for all vaccinations per pediatric medication standards. 181. A 2-year-old should be able to follow simple 2-step instructions. True or false? Answer: true. Rationale: by age 2, toddlers can follow simple 2-step instructions, reflecting cognitive and language development per toddler developmental milestones. 182. Infants should receive water as a supplement to breast milk at 3 months. True or false? Answer: false. Rationale: exclusively breastfed infants do not require water supplements before 6 months, as breast milk meets hydration needs, per pediatric nutrition guidelines. 183. The DTaP vaccine is administered at 11 to 12 years as a booster. True or false? Answer: true. Rationale: the TDAP vaccine, a DTaP booster, is given at 11 to 12 years to maintain protection against diphtheria, tetanus, and pertussis, per CDC schedules. 184. A pulse rate of 150 beats per minute is normal for a resting 8-year-old. True or false? Answer: false. Rationale: an 8-year-old's normal pulse rate is 70 to 110 beats per minute at rest. 150 indicates tachycardia, per pediatric vital sign norms. 185. Family-centered care includes involving grandparents in care decisions. True or false? Answer: true. Rationale: involving extended family, like grandparents, supports family-centered care when appropriate, enhancing child and family well-being, per pediatric nursing principles. 186. Bicycle training wheels are sufficient to prevent injuries in preschoolers. True or false? Answer: false. Rationale: training wheels reduce falls but do not replace helmets and supervision, which are critical for injury prevention, per pediatric safety guidelines. 187. The tonic neck reflex disappears by 6 months of age. True or false? Answer: true. Rationale: the tonic neck reflex, where head turning extends one arm, typically fades by 4 to 6 months, per neonatal developmental milestones. 188. Adolescents require annual physical exams to monitor growth. True or false? Answer: true. Rationale: annual exams monitor growth, development, and health risks in adolescents, per American Academy of Pediatrics guidelines. 189. Oral rehydration solution is contraindicated in children with vomiting. True or false? Answer: false. Rationale: oral rehydration solution is safe and effective for children with vomiting, given in small, frequent sips, per pediatric treatment guidelines. 190. Nurses can disclose a child's diagnosis to non-custodial parents without consent. True or false? Answer: false. Rationale: disclosing a child's diagnosis to non-custodial parents requires custodial parent consent or legal authorization, per HIPAA and legal standards. 191. A 3-year-old should be able to stack 6 blocks. True or false? Answer: true. Rationale: by age 3, children can stack 6 or more blocks, reflecting fine motor development, per preschool developmental milestones. 192. Pureed foods are appropriate for 12-month-olds. True or false? Answer: true. Rationale: pureed or soft foods are appropriate for 12-month-olds transitioning to solids, supporting chewing development, per Pediatric Nutrition Guidelines. 193. The hepatitis A vaccine is recommended for all children at 12 months. True or false? Answer: true. Rationale: the hepatitis A vaccine is given at 12 to 23 months to prevent liver infection, per CDC immunization schedules. 194. A respiratory rate of 50 breaths per minute is normal for a 4-year-old at rest. True or false? Answer: false. Rationale: a 4-year-old's normal respiratory rate is 20 to 30 breaths per minute at rest. 50 indicates tachypnea, per pediatric vital sign norms. 195. Storytelling is an effective psychosocial intervention for hospitalized preschoolers. True or false? Answer: true. Rationale: storytelling reduces anxiety and engages preschoolers, supporting emotional well-being, per pediatric psychosocial care principles. 196. Childproof locks are unnecessary for cabinets in homes with adolescents. True or false? Answer: false. Rationale: childproof locks on cabinets containing medications or chemicals remain necessary for adolescents to prevent misuse, per pediatric safety guidelines. 197. The Moro reflex is normal in a 9-month-old. True or false? Answer: false. Rationale: the Moro reflex typically disappears by 3 to 6 months. Its presence at 9 months may indicate neurological issues, per developmental milestones. 198. Adolescents can consent to all medical procedures without parental involvement. True or false? Answer: false. Rationale: adolescents can consent to specific procedures, e.g., reproductive health, in some states, but most require parental consent, per legal standards. 199. Acetaminophen can be used to manage fever in a 2-month-old. True or false? Answer: true. Rationale: acetaminophen is safe for fever in infants over 2 months when dosed correctly, 10 to 15 mg/kg, per pediatric pharmacology guidelines. 200. Nurses should report suspected neglect to Child Protective Services. True or false? Answer: true. Rationale: nurses are mandated reporters and must report suspected neglect to protect the child, per legal and ethical pediatric standards.